put there, right? No, because I can see his nose.
Sorry, is that your bag? Also, I want it over.
I heard them say hello visitors at one point, though, didn't I? Yeah.
They probably muted themselves. Thanks for us.
We should have gone out there.
I know, I was thinking that
the
this
cost, though,
morning.
isn't it?
I know. And also, I could only get a ticket from Land's End.
I heard you say that.
I just thought the thought of driving to Land's End from
to
the other
the
end
end
of
of
Cornwall, and then it's just too long a day.
Hello everybody in Sedgemoor.
Hello.
Hello. Just to let you know, it is currently live streaming and recording. So it will pick up whatever you say at the moment.
They've got very quiet.
We're just waiting for a couple more people at this end to turn up, and then we'll get going ASAP.
Okay, fab.
Hi. Are you away later this week, did you say?
So quite a good
When is Ted was
Right, I'm on my best behaviour.
There was some question of him being invited to a meeting, so therefore it didn't make sense for him to come home.
He doesn't want to come back to Trachel way back again.
I haven't been given anything more up
See,
to
we've been
date
in
than
training
that.
this morning. We had a 2-hour meeting this morning, so
We're having a busy day.
Oh, goodness me. I had a bit of a break between your last one.
yeah, I did have some lunch.
Oh, good.
We had our AGM.
Oh no, we had our board meeting.
Oh, our board meeting, I beg your pardon.
Morning, afternoon. I think we can probably shut the door and... I'll make it give or take a few seconds, 1:30.
Yeah, we've had apologies from Police and Crime Commissioner and Devon and Cornwall Police.
Okay.
And Ashling.
Yeah.
So, yeah.
Good afternoon, colleagues on the mainland. Can you hear us loud and clear on St Mary's?
Yeah. Yes.
Jolly good. With it being past on the 16th of November, I think we can probably commence the meeting. Perhaps it would be worthwhile just going around the table, introducing ourselves. If we start with Bob on this side, perhaps, please.
Okay, yeah. Bob Dawson, officer supporting the committee.
Peter Davis, member councillor, member for the Isles of Scilly, St Mary's, lead member for adults and vice chairman of this committee. Board.
Joel Williams, elected member for St Mary's, chairman of this committee and also lead member for children and young people.
Fran Grottick, vice chair of the council, and please note the chairman's on leave. The chairman of the council, that is.
Carol Clark, Health Watch manager.
Bob Jones, part of Health Watch.
Scott Fuller, senior officer for adult social care, representing Ashling.
Is that it? We can't see anyone else.
No, it's over to you now.
Okay. Hi, Jackie Banton, Chief Officer for the Clinical Commissioning Group.
Hello, Caroline Court, interim director of public health.
Hi, Sheena Arthur, Operations Manager for EGK, Cornwall and Isles of Scilly.
Jill Thornton, Better Care Fund Lead for the CCG.
Angela Andrews, Primary Care Development Manager for the Drug and Alcohol Action Team.
Thank you very much, all. And just for the record, Andy Thomas is lurking in the corner taking some minutes of the meeting for us today. If we move on to the agenda, item 1 is declaration of interests. I don't know if anyone has anything to put forward at this stage.
No.
Nothing at this end either. We don't have a formal item for apologies, but I think it's just worth saying that Aisling Khan, who is normally with us and is a lead officer for several aspects of the reports, she's not here today, but as Scott said, he's deputising. And Bob just told me that Alison Hernandez, the Police and Crime Commissioner, has also passed on apologies. If we move on to item 2, which is the minutes of the meeting from the 2nd of August. Anyone would like to raise any issues relating to accuracy?
I've received from Jackie's a bit of a slight correction about some of the figures that have been reported, so I will, with Andy, make sure they're incorporated.
Thank you very much.
Thank you.
Any other points anyone would like to raise relating to factual accuracy of the minutes from the last meeting?
No.
I'm just checking if I've been omitted because I might be getting my meetings confused, but I think I was at the last one and I don't think I'm at.
Yeah,
I'm
I think
listed.
you were
I'm not
there.
listed as an attendee.
Okay.
Oh, you are?
Am I?
Yeah.
I picked up the wrong one then.
2nd of August, that's right, isn't it? So, no, you're done.
Am I? Okay. Apologies, it's my accuracy, not yours.
Having said that, though, just on that very front page, you have got Caroline down as both an apology and in attendance.
I think I was there for part of the meeting, so that might explain it.
I think your phone line dropped out halfway through at
That's
some point,
right.
didn't it, Caroline?
Yeah.
So I take the point. It's difficult to be in two places at once. In that case, have we got anyone who can propose and second the accuracy of the meetings with those amendments?
I'll propose the minutes be accepted.
Thank you very much. Okay, we've got a proposer and seconder for those. Item 3 takes us on to urgent items, which I don't have. I don't know if anyone else has any urgent items I would like to present at this point in time.
No.
Okay. And that takes us on towards the meat of the agenda, which is item 4, which is the Public Health Annual Report, which Caroline has put together and I think will talk us through this afternoon.
Thank you. Yeah, thank you for the opportunity to present this. Do let me know if you can't hear me very well. I assume this is working okay, is it?
Loud and clear at the moment.
Good. Okay. As you may know, a Director of Public Health's annual report, I have a statutory duty to produce one, and the Council has a duty to publish it. So this is published by Cornwall Council, but on your behalf as well. And this year we chose to focus on housing. And the reason this came about really was about a year ago now, Duncan Selby, who's Chief Executive of Public Health England, came down to Cornwall, and his message was that the fundamentals of health were three things: a house, a home, a job and a friend, which is a really simple message but actually quite effective. And we started thinking about what the implications around housing for the people of Cornwall and Arsylli. And I will take you through the report. I don't have a presentation, but I'll sort of walk you through it. And the reason that housing can have such an impact on health is partly due to the fact that, on average, people spend 65% of their time at their own home. And clearly there will be certain population groups that will be higher, for instance, older people, very young children, people with long-term conditions and disabilities. I think the relationship between housing and health that we've tried to describe here is quite a complex one, but clearly there's a relation that says that, you know, if you have poor housing, you're more likely to be susceptible to physical disease, so things like respiratory disease, asthma, also physical injury, falls in the elderly, accidents and injuries in younger children, and also mental health problems around particularly anxiety and depression. So if we go to page 11 on the report, we've done a specific statistical overview for the Isles of Scilly. A lot of this information you're probably familiar with already, but I'll just pick out a few of the sort of headlines in that overview. Up near the top right there, it's 15.2%, that's 1 in 7 of households consist of a person aged over 65 living alone. That's quite a high figure. Now, clearly, a lot of those people will be fit and well, but as the population ages, which we know it is, that is going to potentially present challenges, particularly in terms of healthcare and social care and how we deliver that. Also, something I'm sure you'll be aware of, there's a statistic near the top there about the average house price on the Isles of Scilly, 440,000, which I'm sure is a challenge for a lot of people. There's also a figure there, 26% of households lack central heating, and that's very high compared to the average of 3% for England. And of course, you don't have mains gas. I'll come back to that as an implication in a minute. And also, if you look at the bottom right there, the figures on ownership versus renting, there's a high level of renting in the Isles of Scilly. So what we've done is first we looked at the indoor environment and how that impacts on health, and there's a sort of a diagrammatic representation of that on pages 12 and 13. And then we looked at some of the specifics around indoor environment and the impact of health. If you're thinking about indoor factors, the two most important are, not surprisingly, temperature and ventilation. Ventilation is important because you need ventilation to reduce condensation, build up of damp and mould, which can affect people's health, particularly respiratory disease and allergies. And it can also, ventilation is also important. You'll see on page 17, there's a whole range of other toxins and pollutants that builds up in a home that's not well ventilated. So that can be secondhand tobacco smoke, but other things including nitrogen oxides and carbon monoxide. The issue around temperature, that's on page 21. There's a diagram there representing the concerns around low temperature. And this ties in with the high rates of fuel poverty on the Isles of Scilly. Around 20% of homes are in fuel poverty, which is about the highest in the country. So this illustrates the issues around accidents, increased respiratory problems, and anecdotally, it's interesting because Public Health England, as a piece of advice, have said, well, if you can't afford to heat your home, then it may be better to heat one part of the house, or to keep one room warm. The problem with that, although it's probably on balance sensible advice, particularly with older people, is if they're heating one room, then they need to move out to the kitchen or the bathroom, you get a sudden temperature drop. And what anecdotally this seems to demonstrate is that people on that temperature drop, that can affect your blood pressure, you're more likely to fall because of that temperature drop, and that's often a cause of hospitalisation. Then we went on to talk about the outdoor environment, which I think, on balance, is probably less of a significant impact in the Isles of Scilly. I think the outdoor environment is probably healthier than most places. So I won't go into all the detail about that, but there's lots that you can look at in that respect. And then what we did on page 42 and 43 was we tried to come up with 12 recommendations about what we thought would be the areas that we should focus on. And then in Cornwall, what we've done is we've had a bit of a housing summit to think about how we might address these recommendations. So clearly, these aren't the things that public health can do on our own. It's something that's multi-agency. And it might be something that you want to have a think about in terms of, well, what could we do to address these recommendations? Again, I'm not sure all of them would be as relevant to the Isles of Scilly, but there are, like the first two recommendations, for instance, are about disseminating information to residents and to landlords. Recommendation number 10 is about preventing unintentional injuries. That's something we could think, are we doing enough in terms of preventing falls and preventing accidents in children in the home? And then at recommendation 11, thinking about energy efficiency. I mean, I think we have done quite a lot actually on the Isles of Scilly on that, but there is probably still more things we should be doing. And also in this spirit of taking personal responsibility for our health, which is something that we've been thinking about a lot, partly through the STP, we've also included a section on page 44, which is around making our own homes healthier. So this is a thing about wanting to disseminate this kind of information out about landlords and about residents taking responsibility for that. And then the rest of the report is the infographics that we did in the previous year's report. We've just updated those because when we produced those last year, they were well received and they were used by a variety of in a variety of forums in health service, in schools, and so on. So we have updated all the figures in that. I mean, clearly those figures will be Cornwall and the Isles of Scilly because we don't have the statistical information just for the Isles of Scilly. So I'll pause there and any questions or comments?
Councillor Grottick, I think, would like to make a point.
Just a couple of points. I find it a bit sad that everybody over 65 is shown with a walking stick.
I know.
Hair and interest on that one.
I do apologise. I did actually ask for some of the negative. I didn't really like the pictures of people. Actually, that's a better picture than we had originally. But I wasn't very keen on the smokers.
I just mentioned that past. No, I really wanted to note I was quite surprised that we have almost double the rate of young children with respiratory tract infections, which is obviously linked to damp and cold. Sometimes, not always, obviously. But I found that quite surprising. And it is very interesting to look at some of these statistics because you don't always realise the particular health issues that you've got in your particular neck of the woods. I mean, sometimes it just backs up what you think will happen. In other words, because we have a lot of bright sunshine, we would expect perhaps to have more skin cancer rates. But sometimes, like this particular statistic, you perhaps don't realise quite how prevalent something is. So I think it's a very meaty report, and thank you. I found it very interesting.
Thank you.
I would echo that. I found it very interesting and also very user-friendly in terms of the infographics and the way it was presented. I think it's worth saying we were due to have a visit from CRCC about a month ago to look at aspects of fuel poverty, but their trip was postponed because of hurricane-force winds and things. But I think they're due later this month. So that's some positive work that hopefully will take place. And also there's work being done around smart islands, which is relevant to fuel poverty. And it's our expectation at our next meeting, Councillor Jonathan Smith will be able to give some update on how we're looking to address some of those issues through renewables and investment in housing stock. Any other points anyone would like to raise with Caroline?
I was going to do a more general update as well, if that's okay.
Please do.
Everything, that are going on. I mean, I think you've already covered one of them, which was the plan on the 21st to the 23rd of November. So Inclusion Cornwall and the Cornwall Rural Community Charity are coming over to the islands. As you say, that was previously postponed. And that will include the Smart Energy Islands marketplace. So the Winter Wellbeing campaign has been launched. That included a quote from yourself, Councillor Williams, and that will be rerun this year. We have an Isles of Scilly specific guide and the small guide, the pocket guides as well. So hopefully you've seen all those, and they will be launched as part of this 21st to 23rd of November event. So I think that's all positive. In terms of reporting on that, sorry, the top tips card, that's what I was trying to remember. And in terms of thinking about where we got to last winter on that, just so that you're aware, there were 5 households which were able to have free central heating installed. We had a good case study from that. There was a household where they were using the oven to heat the kitchen. And they were supplied with a dehumidifier to dry out the damp kitchen and house, and then had first-time central heating fitted. We also helped 15 households with emergency fund payment, and residents were helped to save money on their energy supplier. There was a case study of one household that managed to save £1,000 just by switching tariff. So I think there were some real positives that came out from that last year, and hopefully they'll be similar this year. The other thing I was going to mention as part of the update was preventing suicide. I think somebody did request that I just gave a brief update on that. So we have a preventing suicide strategy for Cornwall and the Isles of Scilly. We've just updated that, and there is an action plan that goes with that. Now, in terms of the strategy, again, there is this Isles of Scilly issue that there won't be any data. I'm sure you're probably all aware if there was to be a suicide in your area. But the reason that no data is ever published on this kind of thing for Isles of Scilly is if you had one suicide, that would put you the highest in the country because of the size of your population. And if you have no suicides, then it makes you automatically the lowest in the country. So you're always going to be an outlier either way. So that's why you don't ever get published information on that. But the strategy does apply to the Isles of Scilly. It has gone to Ashling and Teo. I haven't had any responses from them yet in terms of if they wanted to input it. But I haven't. It's not something we'd want to circulate as a document for a public meeting yet, because it's not in that form as yet. But if anyone was interested in seeing a copy of the draft, then I'm very happy to share that either directly. I can send that to you, or obviously Teo and Ashling have copies already. But we'd very much welcome any comments on that. And then the other issue I was just going to mention was just having a talk with the team about what other things from public health that you might welcome. It might be a conversation particularly with Ashling, but what we were thinking of is perhaps 2 or 3 members of the team coming over to the island to do a bit of a sort of blitz on training in terms of, because we offer an awful lot of training through the public health and health promotion team, but it's not something that's probably very accessible. Therefore, we could offer making every contact count, smoking cessation, health checks, mental health first aid training. So I think it would be good just to have a conversation about setting something up for that for the new year, to ensure that you're not missing out on those sort of training opportunities if there are staff that are interested. That could be staff from the schools or from the health service, or anybody actually, in fact, council staff. So that's just something to bear in mind. And that's all I was going to cover on the update, if that's okay.
Certainly the offer of training sounds very encouraging. I'm aware there was some assist training related to suicide prevention and related issues a couple of years ago, and that was very well received. And I was also just going to say that I'll make sure that your report is shared with colleagues from housing and environmental health who can't be here today, to again just to make sure that they're fully linked in with the findings of the document. Okay, that's great. And if there's any sort of feedback in terms of how we can work with housing, because we obviously had that conversation at Cornwall, but we haven't had a sort of similar conversation with housing in the Isles of Scilly. But if there's any interest in any joint working, we'd be very happy to explore that. And I'll also make sure I pick up with Ashling around the offer of training as well. Certainly sounds like we could move forward. Okay, good. Thank you. Any final points anyone would like to raise at this point? Okay, thank you very much. I think we just had a recommendation to note the contents, didn't we? Nothing. Yeah, so we can certainly note the contents, and it sort of feeds into later items on our agenda. So thank you very much indeed for that, Caroline. Thank you. Item 5 is over to you again in terms of pharmaceutical assessment, I think. Thank you. This is a short one. So, pharmaceutical needs assessment. This is something under the Health and Social Care Act that there is a requirement that health and wellbeing boards are responsible for producing a pharmaceutical needs assessment every 3 years. Now, the first one was published. We published it as a Cornwall and Isles of Scilly on the 1st of April 2015. So that means there's another one due by the 1st of April 2018, so next year. So there's a statutory process that we have to go through in this. The pharmaceutical needs assessment, it's not very imaginative, shall we say. There's a very structured way that you have to produce them. But we need a 60-day consultation period for a draft. So this paper is really asking to delegate authority to myself in consultation with you, Councillor Williams, in terms of as Chair of Health and Wellbeing Board, to approve the draft so that it can go out to consultation. Now, the reason I'm asking for that now is because it's not ready. It will be ready in the next few weeks, and we need the consultation period to start by the end of November in order for it to be
the process to go through, we can get the draft, and we can publish it by the 1st of April. So it's just asking for delegation, please.
Okay. I have no objection to that process. I don't know if anyone else has got anything to feed in from this side of the water.
It sounds quite straightforward. I'm happy to recommend as a proposal that we accept recommendations 1 and 2 on page 92. If anyone has any other comment? No. I think we're happy with your proposed way forward, Caroline.
Okay. Well, I'll send you the draft so that you get a chance to see it before we publish it for the consultation.
Thank you very much indeed.
Thank you. Thank you very much. That's me done, I think.
We might call on you in a minute, but I think that takes us to.
Just thought, as it was a sort of formal recommendation, you might need a vote.
Okay.
But obviously, it's up to you, Chair.
We'll just take a vote on the recommendation, Caroline. Anyone against the recommendation in page 92 of the report?
No.
Oh, is you all in favour? Thank you very much. Andrew, I think that brings us on to item 6, which is your drug and alcohol needs review report.
That's right, yes.
Please feel free to talk us through it.
Oh, I thought no. Well, we haven't discussed this in advance, Angela. I'm very happy for you to present it if you feel comfortable to do that.
Yes. Okay.
So apologies if I've got the wrong end of the stick. I'll let you approach it in whatever way you feel.
Yeah, no, that's fine.
No, it's fine, Joel. I'll take you quickly through the report. Is that okay?
Please do.
Okay. Right. I think you remember just over a year ago, Joel, you and I having a conversation about there not being any recent or up-to-date information around the drug and alcohol needs and prevalence, etc., on the islands. And so it was actually yourself and myself and Aisling who kicked off this whole process. So this is kind of the culmination of over a year's worth of toing and froing and collecting information, etc. So it's been very difficult for lots of reasons, and Caroline's mentioned some of them, to collect specific data for the Isles of Scilly. So in the end, we undertook, in conjunction with Health Watch and with the police, we did quite a lot of stakeholder professionals and public consultation, which is the basis of the feedback around the work delivery plan at the end of the report. So 2012 there was a health and wellbeing report which Sarah Roberts wrote that. There was some worrying statistics in that report, and one of them, the worst one, was the Isles of Scilly hospital admissions for alcohol-specific medical conditions was rate per 1,000 population twice the Cornwall average. We've not been able to come up with more recent data than that, but what we will say is that Cornwall and the Isles of Scilly combined have had a rise in hospital-related alcohol-specific conditions over the last few years, which is now at last beginning to decline. So that's been one of our most worrying trends, but it is going down now. Okay, so sorry. So that, and alongside the fact that you've got a population of just over 2,300 adults. Given the prevalence in Cornwall and yourselves, we would expect around 500 people to be drinking at increasing and higher risk and dependent levels on the Isles of Scilly. Okay, so that's what we're looking at, and alongside of that, in our treatment provision to the islands, which my team commissioned, was actually declining as well. So we had some concerns about these rising hospital admissions, the decline in number of referrals, and the treatment delivery to your islands, and that has kind of formed the basis, the bottom line of what I was trying to find out some of the reasons for those things in this report. So we looked at the current provision, and looked at the actual activity, service delivery on the islands. And Wise Up, the young people's service, has continued unabated for the last 10, 15 years, and that's been really well received. But the actual adult interventions were beginning to decline, and I've noted that on your last Health and Wellbeing Board there was a query about this from one of the councillors. So, so in February this year we completely remodelled the service to the islands, and it appears to be being quite successful. We've had a lot of referrals, and Steve Slade, who's your new worker over there, he seems to have built quite a lot of relationships and be taking things forward. Most of our referrals come through self-referral. The police have been instrumental in referring people for brief interventions who are involved in antisocial behaviour or other incidents involving alcohol. And adult and children's social care services have been very helpful in pointing people in the direction of services. Okay. So the majority of the referrals are low. I think you're aware that alcohol is your main problem of your main problem drug on the islands, because actual drug use is the incidence appears to be quite low, and that's based on the number of seizures by the police and the referrals and other information through people like your health professionals. Okay. I looked at the most recent GP Quality Outcomes Framework data for alcohol-correlated diseases, and for things like stroke, depression, obesity, mental health, smoking, coronary heart disease, these are all strong conditions strongly correlated to alcohol use. None of them showed any sort of blips. This is the data from your health centre. So I think it's fair to say that at this moment in time, your health statistics are not reflecting what we would expect if there were any greater prevalence of problematic drinking and its effects on health on the Isles of Scilly. So I'm saying that it looks like in terms of health, probably you've got the same level of problems related to health as we have on the mainland. Okay. I couldn't get any data from. Anecdotally, people I've spoken to on the island say, yeah, we've got accidents happening because of alcohol intoxication, and people are picked up by SWAST, the ambulance services, because of alcohol intoxication. But I couldn't get data from either of those sources, so I can't really comment on either of those things. But anecdotally, that's what people tell me. So I think if you look through the report, you can see what the comments that Health made around their take on alcohol and use of other drugs. Okay. And the other thing that came up was we did a mini audit in the pharmacy, the community pharmacy, but over the counter and prescribed use of codeine and other low-level painkillers, and it was actually quite high for the Isles of Scilly. So this is sometimes what happens in some very rural areas, that easy to come by opioids such as codeine can be used as a substitute for as a kind of choice. Okay. So that was quite interesting from our point of view. Let's have a look. And so our addiction worker out there is trained to work with people who perceive that they might actually have a problem buying medication at the pharmacy or actually getting it on prescription. And that's not unique to yourselves. We have this problem all over Cornwall as well. Okay. Okay, Health Watch, thank you, Carol, ran a wonderful public public survey for us just over a year ago now, and the findings of that can be seen. So these are public comments, lots of stuff coming up about influence of young people and alcohol and drugs on young people, and a lot of concerns around that, and a lot of comments about how they would like to see a more robust service to the islands, which hopefully we're in the process of achieving. Young persons and people in the school. You have the child and adolescent mental health services, tier 2, 3, 2 weekly, 2 day a week presence on the islands, and our drug and alcohol worker now works in conjunction with those professionals. Okay. Licensing. This was the biggie. Okay, we're the seven. Apparently, there are 7 licensed premises on the island. That's a concentration per geographical area, similar to Newquay. Okay, and at the moment, and this is in the context of things like gig weekend, there's no public health input to the silly licensing processes. A member of my team is involved in the pilot project in Cornwall Council, Health as a licensing objective. And it is one of the recommendations of our team that, if you're willing, that we work with your licensing to help you implement that. Okay. The police and crime stuff that came out. Okay, you can see the blips if you look on page 16 of gig weekend is red when your crime escalates, as is in the summer months. And alcohol-related crimes that have been identified where alcohol has definitely been a factor include the list on 17. And some of these are for domestic abuse crimes, quite a lot of common assault and actual bodily harm, etc. And 8 miles of roads on the island, 150 cars and 15 people convicted of drink driving in 3 years. We thought that was quite okay. Okay. Coroner's inquiries. You might not have been aware of this, but in the past 12 months, there's been 2 coroner's Regulation 28 inquiries for the Isles of Scilly, and these are. Dr. Emma Carlyon will issue one of these if she feels that a death may have been preventable, and what can we do to stop it happening again. And both of these were related to alcohol, illness and dependency. Okay. Okay, so on pages 22 and 23, I've made a list of there's a delivery plan. We're already the Drug and Alcohol Action Team, which I belong to, is already committed to our delivery plan. That's and we're beginning our training plan next week with the substance use for young people screening training. There's an Action delivery plan. They're our commissioned provider, and they are committed, and we are contract monitoring them through our quarterly reviews on this on the delivery of this. So that we're trying to ensure that you do have a coherent, cohesive and regular attendance on the islands for specialist services and access to everything that people on the mainland will have. And then there's the plan for the wider development, which is really what I need your feedback on, really, whether you think that plan for wider development for the promotion of sensible drinking and use of other drugs is feasible and acceptable to yourselves. That's it from me. If there's any questions.
Thank you very much indeed.
I'm sorry to go on.
No, not in the slightest. No, it was very helpful indeed.
Right, thanks.
Before throwing it open, there were just a few observations I wanted to make.
Yes, okay.
Certainly the comments about licensing come at a very timely juncture for us. My colleagues, 2 elected colleagues on my right and left, sit down on a monthly basis, and we have sort of community surgeries that allow the general public just to come and air any concerns. And it's there's been a common theme about late night noise, nighttime economy, and aspects of antisocial behaviour. So that's something which we can perhaps touch upon in a minute. And I was also going to say there's 2 members of our elected body, at least 2, who are very closely involved with the lifeboats. So again, we've got some leverage in there. I know you note them in your report. And I did see an advert on Facebook recently for a sort of volunteer life RNLI community engagement officer. So again, there could be something which happens along that line quite quickly. But I don't know if anyone else has got any further comments at this stage for Angela. Barbara?
I'd just like to make a point when you were doing the numbers for the Isles of Scilly, particularly on the alcohol side, and I wondered whether, when you were talking about the number of people that needed hospital treatment or treatment as a result of something that had happened, alcohol-related problems, whether you also bore in mind the fact that many people, obviously in the summer, we have loads and loads of visitors. Do you make any sort of distinguishing factor between the people who actually live here and the people who actually are visitors having a good time?
Yeah.
Is there a division?
There definitely will be. The figure that is quoted in the report is, I think what you're referring to is on page 2, where I've put the resident population of the island in 2016, 2,353 adults. Now, based on the prevalence in Cornwall and for Cornwall and the Isles of Scilly, which is Public Health England data that we in the Drug and Alcohol Action Team get regularly, we would estimate that 585 resident adults, i.e. 25%, would be drinking at what we call increasing risk, higher risk and dependent levels, which are the levels which are problematic to health and social functioning and yeah. Okay, so that's specific to the residents. Okay, so sorry, I thought you were going to say something. So that's the figure that we're working on because we provide treatment services to residents. Okay, so that's the figure that we would estimate would be the number on the islands, of which around, if we had good services, around 10 to 20% of them would be engaged in treatment. We haven't got anywhere near that number, but that's what we would reasonably expect, and that would be our target if you were on the mainland, at least 10%. So say 50 people in treatment, that's the estimate that we're working on, that should be achieved. With regard to your visitors, I didn't manage to get any specific hospital admissions data at all. Sorry. For this report, I have requested it, but there has been some problems recently with getting the hospital episodes data, I believe. So I haven't actually had that recently, and that will form any future review of this report. But if you look at the crimes, the crime data, crimes and antisocial behaviour, in that section, it does go up in the summer months when you have got a lot of visitors, and also gig weekend in April or May, depending on when it occurs. So what I'm trying to say is I can't even make a guess at what sort of breakdown there would be between people who visit the islands, except to say that there is obviously an impact on visitors to the islands in terms of your health provision and policing and crime and other antisocial behaviour.
Okay.
Thank you very much. It just felt like we were all becoming alcoholics on the outside.
No. This is something that I'd be very keen to say to you, is that it looks as if the levels of alcohol consumption is about the same as in Cornwall, about the same as rural areas across the country. But I suspect, and this is a personal opinion, which I haven't put in, I suspect that the impact of the behaviour that sometimes results from increasing and higher risk and dependent drink is probably more visible in your small community.
Thank you very much.
Okay.
Yes, I would like to make a few comments. Starting with your dealing with the differential, if you're trying to differentiate between visitors and local residents, I think we're, as a health and wellbeing board, it's up to us to look at the causes. You're doing, a very admirable report, and it's quite clear that a lot is being done in the treatment, but the treatment will only increase if we don't tackle the causes. And I know we all realise that this is a national problem, and it's a cultural problem, and it's got worse over the last few years. People go on holiday to binge. It's part of the culture of Gig Week. But quite frankly, I found it very interesting, and it's a very explicit report, and you've obviously done a lot of very good work. But when I read it and go back, and yes, I've picked up on your 25%, but when you're actually reporting that children are appearing at school intoxicated, it really makes you sit up. We've got 70 licences pregnancies. Okay, this is similar to Newquay. Well, we all know here, we hear about the problems that Newquay suffers with. That gets a lot of local publicity, but obviously we're in the same sort of area of being a holiday place, and I think that we should really use this report to be a little bit more proactive, perhaps. It comes through everywhere, doesn't it? You brought out the road traffic figures, which are also, above the average by, if you measure it by car or by mile, it's obviously over the top or very high. But when you hear that I know Gig Week's an exception, but it does spill over to the rest of the year and the holiday period. When you hear that the police are overwhelmed and the medical services are saturated, these are the words in your report. I think it's high time we should perhaps be a little bit more proactive and perhaps be unpopular. I know the local police have recently had a meeting with the licensing committee, and they make commendably at the point about not trying to be unpopular and being spoilsports, and people need to enjoy their holidays, but perhaps this sensible drinking should be to the fore of our efforts, because things are getting worse, and it's causing a lot of illness and a lot of it affects the crime figures, it affects the illness, and it has an effect everywhere. And I really think that perhaps we should amend the recommendations when it comes to making the recommendations to back up the valuable work you're doing. And it's high time, as I say, that I feel that we should really get involved.
Thank you very much.
Councillor Davis mentioned the licensing committee in his discussion there, and I think it's certainly something for those unaware, there is a licensing committee as part of our Council of the Isles of Scilly structure, and I think this report has to go to the chairman and the staff. And I was interested in, is it HALO, the project that is rolled out in Cornwall?
Yes, that's right.
I don't know if you could tell us a little bit more about that.
It's short for, acronym for Health as a Licensing Objective. This year, for boardmasters in Newquay, my colleague Jez Bays, who I think some of you might know, he was the specialist drug and alcohol person who represented public health and public health priorities as objectives in setting some of their licensing parameters, and lots of recommendations were made that improved the health and safety of the delivery of that festival. And as I understand it, it was very successful.
Caroline, did you have a comment?
Yeah, I just thought just to sort of do a few general comments, really, I suppose, in terms of the needs of people of the Isles of Scilly. And I think it's about getting it in perspective, isn't it, really? I think it's what Angela's sort of saying. Actually, and I've said this to you many times before, actually the population of the Isles of Scilly extremely healthy overall. It's hard to find anything that we would be particularly concerned about. That said, alcohol does seem to be coming out as a bit of an issue. The coding issue is interesting. I hadn't come across this before, and it's something I think you just need to be mindful of, really. I think what's been put in place in terms of treatment is the absolute right response, and I think that's all in hand, really, now. In terms of the licensing, as Angela said, health as a licensing objective actually has just been turned down nationally, hasn't it?
No, has it?
Or not been recommended to go forward. But actually that doesn't really matter, because you can put health criteria into your existing licensing considerations. So whether it's an extra objective or not doesn't really matter. But that's obviously something for the licensing committee to be thinking about in terms of where they want to go. I mean, there's always a balance between economic and health, isn't there, in those kind of situations. But I think it's definitely something to think about. And Jez has done some really good work on that. And then the other issue, I guess, is just about something about messaging and thinking about, are we getting the messages out? Just the general message, general public health messages about sensible drinking. So that's the areas I would suggest focusing on.
Could I just add, from a CCG perspective, we did go away from the last meeting and conducted some analysis and fed back into the commissioners as well. So we did look at residents only, and we looked, it's very difficult to analyse the information sometimes, but we looked for alcohol related admissions, not these just that turning up at A&E, but actual admissions. And there was 18 cases with a definite link to alcohol as a primary diagnosis. This year, when the analysis was undertaken, we only had 3 months' worth of analysis. So this year we had, up until June, 3 cases, which pro rata, if you equalled it out, is slightly less than we would expect. But again, small numbers. We also looked at comparative areas. We looked at the Isle of Wight, and we also accessed their Health and Wellbeing Board data, and also another small island which I forget, and actually they experienced very similar problems, and similarly reported by the Health and Wellbeing Board as well. So we may have to do some group working with them potentially.
Yeah. Can I just say, from the work that we do with the older population, it would be great to work together in terms of, because we do see a lot of people with where alcohol may be an issue, but linked with people's mental health and isolation and depression and conditions like that.
Yeah.
So very much how do we collaborate to generate a more sort of cohesive approach for people.
Yeah,
would be positive.
I spoke to the lady who was delivering Age UK. Oh, sorry. I did speak to Age UK, and there was an estimate of which correlated to of how many people she had on her caseload who may have some sort of problems with alcohol use, and that again correlated to our general estimate of the prevalence of it reflected the assumption that your levels of problematic alcohol consumption are approximately the same as we've got in Cornwall, which is slightly higher than the national average, I would say. It's about 1 in 4 rather than 1 in 3.
Okay, thank you.
Okay.
I think Scott had a comment.
Yeah, it was just literally relating to the 10 to 20%. I mean, I think you said that the take up within Scilly of the treatment is less, doesn't compare to Cornwall. Is there anything or any recommendations that's being put in place to actually address that, to enable the take up, or to try and enable the take up to pick up?
Okay. I think I said that the numbers in treatment was less than we would expect in the on the mainland.
Yeah.
Yes. Yes. Sorry. Okay. Right. I'm in the process over this winter of delivering an extensive training programme for health professionals, and I had a conversation with Carol a couple of weeks ago about advertising some public and people working with young people's training programs. So when I'm over there next week for some training, and I'll be visiting with Carol, because we're going to talk about some training opportunities that we open to the wider community, not just professionals. But we've got all sorts planned for over the winter. We're going to do screening for alcohol use and motivational approaches. And we're going to do blue light training, which is working with entrenched drinking patterns, who are people who don't really want to get into treatment, but do need a bit of some change, behavioural change. Sorry, what else are we doing? Okay. Basic drug awareness. We're going to do that training, and and next week we're doing the substance use screening tool for people working with young persons. So we've got quite a lot going on over the winter. Hopefully we'll get out there despite the weather to deliver it.
That sounds very encouraging. So I think just to clarify, I think I'm picking up 3 actions that I'll take forward. One will be to liaise with elected members and staff involved in the licensing committee over here. Referring it also to community safety partnership members, so again it doesn't get lost in the work they do. And I'll also touch base with the RNLI as well around some of that water safety and some of those aspects. It sounds like you've got a lot on, Angela. And Adrian, if we just move on to recommendations now, are you suggesting we tighten up recommendations?
Well, I was only going to add, could we make a formal request that HALO is extended to Scilly, and that, following up also what you have said, that licensing, this report goes to licensing with our concerns.
Yeah, fine.
Thank you. Thank you very much.
Could I just respond to Scott's comment as well? Because at the last meeting it was about accessibility of services, and there was some concern about people being able to attend. And following that meeting, the CCG contacted Ad Action and Public Health, and at that point we were reassured that additional appointments were being built into the service. Unfortunately, I've not been able to check back that that's actually happened.
Yeah, we're the commissioners of that service of Ad Action, and yes, it has. I've been monitoring very carefully since February the delivery of the service to the islands, and I have to say that it has improved hugely. Yeah, and we have actually in effect doubled the amount of provision available to the islands.
Okay, thank you.
Could I just ask, out of interest, on the bottom of page 116, with reference to responsible alcohol retail, you use the word SMART. SMART means something slightly different to us over here. I wondered if it's an acronym for something else.
Yes, it is, and I hate to say that I don't know what that acronym is. It's to do with retail trade. It is substance misuse and responsible retail something or another training. Substance misuse, responsible
retail training.
I don't deliver that training, and I'm not the alcohol expert in my team, I'm afraid. But it's training for people working in the licensed trade to be able to recognise signs and symptoms of people who may be.
So it's dealing with the problem of selling to intoxicated people.
Yes, that's part.
Which is very pertinent.
Yes, yes.
I think Bob had his.
Just a query in relating to your first action, Chair. Do you want me to arrange a meeting with Angela and the licensing chair and licensing officer?
It would be very helpful.
If you have time, Angela.
Yep, I'm on the islands next Tuesday and Wednesday. So we are doing training, but I can, if you send me an appointment, Bob, I'll pop out and see whoever you are going to set up the meeting with.
That's lovely. Do you know where you're carrying out the training?
Yes, in the Wellbeing Centre. The Wellbeing Centre on Tuesday and the Health Centre on Wednesday.
Okay. Thank you.
Okay.
So on page 93, we have the two recommendations you presented, but I think we're moving towards perhaps a third one where we can play with the exact wording, where the Health and Wellbeing Board refer this paper to the Licensing Committee for them to consider the aspects which are relevant to their work, perhaps. We can tighten that up, but I think in general we would like the Licensing Committee to come on board with the work that you've presented with us this afternoon.
Thank you very much.
Halo.
Yeah, which would encompass Halo and the smart training specifically, I think would probably be most relevant to what they look at.
Okay, thank you.
Do we need to formally accept those recommendations with the proposer and seconder? Thank you very much, and thank you very much. Thank you very much for your time, Angela, and might bump into you next week, weather permitting.
Yes, okay, thank you, yes.
I think our next agenda item is a verbal update from Carol and Barbara on Health Watch.
Thank you. All I'm going to talk about today is some early feedback from our recent community survey report. Every couple of years we aim to do a household survey, which means that a paper survey goes to every household on the island, and we usually get about 20-25% response from that. And that's what happened this year. We went out to 978 households we identified, and we had 215 returned, which is about 22% response. And what we do in the survey is ask everybody about everything, ask them to give a rating for services they've used, and add a comment. So it's divided into service sections, and then this year, because we recognise that when we're asking people to comment on services, we're kind of breaking up the narrative of their whole journey. We ask people to tell us their story about their particular experiences, either as a cancer patient or with adult mental health, various areas of treatment and care. Now, we're kind of halfway through analysing and collating that feedback and writing it up. The process is that only providers will see the transcript of the verbatim comments about their service. We summarise those comments in our report, so we ask providers to let us know if they think our summary is fair and accurate, and then ask them if they would like to respond to what people said in the survey. So the final report will just have our summaries and responses from service providers where received. And at that point, we will send that report out to commissioners, to the Health and Wellbeing Board, to councillors. So you've got that snapshot of what people are saying about the services that they're receiving. So because the report we hope will come out early January, I don't know when the next Health and Wellbeing Board is, we've pulled together some early feedback just to give you a taste of what people said. What people said was that primary services on Scilly generally work very well. Very, very high ratings for the services provided by the GP practice, and we included practice nurse clinics and what else did we include in that? I can't remember, it's gone out of my head. They also provide optometry and pharmacy. Now that was a little bit more mixed. I think the pharmacy grumbles related to a recent temporary blip in opening hours, which has now been resolved. And interestingly, the comments about the local optometry service, I personally think were probably a little bit unfair. I think there were high expectations on that service as being able to deliver everything a big high street chain might deliver. Our conclusion was that the service, it's vital to have that local access to eye tests. We do have that. It's working. It's an add-on to a high street service should you want to use that while you're on the mainland anyway. But it does give us local access to eye tests, which is what we needed, and it is what we've got. The other primary care service, the dental practice, had very mixed ratings, which you'll see in the report. I think this does refer to some ups and downs in that service, and there have been concerns expressed at this board about recent referral pathways and support for referrals into secondary care. and what to do when NHS treatments can't be delivered on island. That's a failure of provision rather than a commissioning issue, but we have discussed it with NHS England, and we've discussed it at length with the provider, who throughout the ups and downs of the last 2 years have listened and been very responsive. So what we have now is pretty much back to normal service. We have a full-time dentist, 2 receptionists, appointments are being handled in practice, which is what everybody wanted. And NHS England and the service provider have looked together at referral pathways, so that should now be clearer. And we've raised that through the medical travel around authorisation of travel warrants for secondary care. So some blips there we're hoping have been ironed out. So I think really we're back to business as usual. So that section in the report is kind of retrospective, but we'll be monitoring it and looking at it again as we go ahead. The other highly rated local service provision is all based at St Mary's Hospital. And interestingly, there was a very high number of people rating and giving good ratings for their inpatient care at St Mary's Hospital. And we were pleased to see that, because grumbles in the past have been about perceived underuse of that facility. And I think that in itself indicates a good level of use of inpatient care and very good feedback about that. Now, I've been, myself and my colleague have transcribed every word from the survey, and we've sorted it all out, and we've put it into order, and we've looked at it and tried to read what it means, and we've actually got to a point where we can no longer see it and what it says. So I've run everything past my board this morning for really first impressions, and one of the things that came up is that ratings, when you look at them, while they're very good for primary care, when we get to community health care, they start to dip. So there were mixed ratings for community health services, which is therapies where clinics are held on the island. When I look back at it, I think what we can say is that treatment and care was felt to be very good, but provision might be difficult to access. It might be a long wait for an appointment, might be a long list. And all those clinics are subject to travel disruptions, so there are frequent cancellations, and they're not always rescheduled before the next visit. I do know that CCG and local clinicians keep an eye on that, and there is a kind of winter situation report that goes through to you guys. So if physiotherapy can't get here for 3 weeks in a row, that won't be allowed to carry on. That will be rescheduled, and you're keeping your eye on that. So I think that's covered. Adult mental health care, again, a community health service in theory. In practice, I think the GP practice carries a great deal of that. Very mixed comments. Over half of the people who left a rating said that their experience generally of services was good or better, but the comments indicated that people have great difficulty accessing help isn't there, and when you have had help, follow-up and monitoring is poor. Very few comments about that, but I think it's a story that we've heard, and I know that there is some funding earmarked to improve local delivery of adult mental health care and support. And again, that'll be one that there have been difficulties actually improving that service, and we support any efforts to improve it. Children's services, I think this is we got through the survey very little feedback about children's health and care services and other children's services. I think, as with adult social care, those services are supporting quite a small cohort of people, and of course we only asked people in the survey about services they had used. I think what we need to do is look at our own community engagement here and remind people that Health Watch actually does still cover care and care services, and look again at our engagement and how we get feedback about that. Our direct engagement with young people is about to resume with another takeover challenge by the Student Council, who come and take us over for a morning and run a board meeting and go all over our work plan. That's happening again next Friday, and we're continuing ongoing links with the Student Council to involve them much more on everything we do. I think we need to sort of really rethink how we're talking to and encouraging and getting feedback from families with children and around the sort of broader provision for adult social care. What I will say, jumping ahead a little bit to adult social care, is that we did get very good feedback about other community services that are supporting adult social care provision, and that would be like the Memory Cafe Activity Club and the Living Well service. Had quite good feedback from our survey. Going back to health, we did a whole section on going to hospital, and there were very high ratings for outpatient appointments and inpatients. Treatment and care were felt to be very good, and Trelisk got its highest ratings and comments about cancer services. But we had very mixed feedback and poor ratings about arrangements on discharge. And that doesn't just relate to, it does relate to our journey home and lack of preparation at times for the journey home, but there are still problems about getting meds up from pharmacy and other delays on discharge. And again, all this has gone to our CHT to look at. The experience of cancer patients, we gave that a separate section. Now, in the sections in the survey where we asked people to tell us their story, quite a number of people just used that to add further detail to what they'd already told us when commenting on service provision. So some of those comments have gone back into the other sections. Where I didn't do that was around the experience of cancer patients, because that story goes across services from diagnosis to treatment and care, and then aftercare and continuing support. And again, very high ratings for very good treatment and care received. Most comments concerned the very onerous journey for medical patients, and for cancer patients in particular, that is a burden, and problems about accessing affordable accommodation when you are on the mainland receiving treatment. And we are taking that up again next week with Macmillan and RCHT around assistance that can be given to patients. And one of our board this morning did come up with an idea which we're going to follow through with, and which might help to improve that experience. Adult social care, the feedback's gone to Scott. It was mixed feedback. Arrangements for care and support were rated good, and as I've said, it was a small amount of feedback, and I think we need to think about getting feedback from people who might not be using those services but might need to. We're looking at unmet need here, and I think that's something that you'd be interested in as well. So that's kind of a future task for us to look more broadly around that. Local members of council here will be pleased to hear that council provided community services received a very high number of ratings, and the majority of ratings for all community services were good or better. Much appreciated provision. And the highest this year, I'm sorry, but Buzzer Bus got knocked off its perch. Age UK did have a section, and Buzzer Bus is highly, highly appreciated, but this year the winner was the library. Really, really good feedback about our local library, and you guys need to know that. We got kind of mixed feedback about Normandy Pool. That was where ratings got a bit wobbly in terms of service provision, but actually we then did another section and asked people to rate their own health and well-being and cite sources of what supported that. And loads of people said it was swimming and using the pool. Use of the pool seems to be a very important facility for supporting people's health and well-being here. So the health and well-being section, I just don't know what to do with this. There's masses of data here. We asked everybody in the household to rate their own health and well-being. We got 315 responses, which I think is a really nice number. It's quite valid response in terms of drawing conclusions from that, but mostly the conclusion I can draw from it is that people between 60 and 80 are most likely to fill in a survey because they account for nearly half of all responses. So everything from then on is completely skewed and must be read, that actually people between 60 and 80 are telling you this stuff, and nobody else had much to say. And they're using the services more. But how they rate their own health and well-being, the majority of people rated their health and well-being as good or better. When asked what supports them, most people said services provided by the GP practice, and primary care is very high. That's because that's most of us, that's our highest frequency of contact. Specialist health services did come up there quite highly, and also other. And when I just couldn't put a column for everything, but an awful lot of people said me, my wife, walking my dog, my friends, and community support, family and community support was also given as important. Then we asked people what would make a difference. And this is where they suggested where services could improve. And this is where the dental practice got a wholly uncalled for kicking, really. But that was interesting. That
kick in the teeth?
Yes. But I do think we're kind of over that. But a lot of comments, again, the next highest is other. And that would be from a female respondent that said what would make a difference would be having a wife. And then on the same sheet, her male partner said, well, in that case, I perhaps need another wife. So we got a bit of that. Nobody wanted another husband. Sorry, they just didn't. But then when the next one, looking at the categories of what people were saying, the next highest category was accessible services. And that became really important, that actually where things could be improved was making all services more accessible or making access better. And that applies from off islands down to St Mary's as much as across the mainland. So we kind of divided it up in all kinds of ways, by age, by how people rated their health and well-being, by how people cited services. So I've actually wrapped all that up and forwarded it to Aisling and Bob, and it'll be in the whole report. But this supporting data, I think, might be useful for members of the Health and Wellbeing Board, and so in due course I'll wrap that up and send it off to you guys.
I'll just ask one really silly question. So when you say access to services, do you mean actually access getting to, or access as in being able to use?
I think a bit of both, because I can actually read some of those comments that I kind of put into that category. Better access to mainland consultants, i.e. more use of technology for remote clinics. Okay. Cheaper access to community services, so that was expense and cost. Again, decreasing the need for travel, perhaps things that you have to go to the health centre for, especially if an off-island, could community nurses take on some of that work and actually deliver it on off-islands rather than people having to come down to the clinic, so blood tests. Another one was, again, a real effort to do some consultations by video link. So a lot of that came into actually, can we access these services differently than having to go there? Yeah. So that could be either from here to over there or from the off-island to down here. But it was about cost. Yes, and again, another one about cost. So alternative delivery models and perhaps looking at costs as a barrier.
Thank you very much. I think provisionally our next meeting will be late January, so that might tie in well with your publication date of the full report.
And I'm hoping as well that it will come out. We're having our wave 3 of the Shaping Our Future consultations kicks off in January. So I'm hoping to get it out really quite early in the new year, so it can, you've got that data for that as well.
And I'm also delighted by the comments about the library as well. I'm sure Andy in the corner's mother, as our principal librarian, will be very pleased to hear those comments again.
Tell her when you get home.
Councillor Grottick.
Thanks. I just wonder how much. I mean, it's great getting all this feedback, but it is so difficult to extrapolate some of what they're saying. For example, we had difficulties with the pool opening for quite a large part of the year because we had a difficulty recruiting to 2 lifeguard posts. So people couldn't access the service when they wanted to. Well, actually, that's not a criticism of the pool per se. People love it. It's the fact that they couldn't get there. So something that appears to be a criticism is actually not. It's saying, please, can we have more of that?
Well, you will get.
How is that shown?
Aisling has
Actual
got
narrative.
the verbatim feedback and the actual
that's fair
comments,
enough.
and how she
Yeah.
shares those. I leave to her.
Of course.
But yes, it was mixed feedback, not and constructive criticism.
Oh, sure,
in many ways.
Yeah.
Carol just raises a point there, which I'm very conscious of. Aisling doesn't manage the swimming pool, that's sort of part of Teo. So I've had this discussion with Bob and Teo and our Active Silly manager that Active Silly, as our sort of main wellbeing provider within the local authority, isn't represented around the table of this Health and Wellbeing Board. So that's, again, just something to throw into the mix, but it's something I'm well aware of, and there's a bit of a disconnect, certainly in terms of what Caroline was talking about earlier.
Perhaps if we're discussing this in January, excuse me, sorry, you didn't ask me to speak, but perhaps if we're discussing this in January, you could invite the Active City manager or indeed the chief executive as head of that department to actually sit round the table with them.
Absolutely. Any colleagues based on the mainland would like to raise any points at this point?
I would, yeah, it's Jackie. So that's really comprehensive and would really welcome seeing that. I recognise that you're saying you sent some stuff to providers, but it's also useful for us as commissioners to have so that we can follow up in our quality meetings with them. I guess the bits I absolutely recognise are the issues around discharge, even putting transport aside. So you'll know that we're paying a huge amount of attention, and again, I'm sure we'll come on to that as we go through the Better Care Fund, but that is an absolute focus for us. As always, as soon as you set a national target, it becomes an absolute focus. But we're very aware that patient experience around that area isn't good. The other bit I would just say, interestingly, we had our clinical leadership group on Tuesday afternoon, and Phil Confu, as the chief exec of CFT, was invited because actually a lot of the GPs have been raising quite a lot of issues around mental health services in the community. So not just Isles of Scilly, but generally on the mainland. And most of their issues, complaints, as always, come down to just poor communication. So a lack of understanding, even between the clinicians, about which users would fit in which service, and people falling down the hill and just feeling like people are just being churned around the system and not getting the service they want. So Phil took all of that feedback and actually quite a lot of it came from the practice on the islands, probably disproportionate amount of feedback from them actually, a lot of very individual kind of case studies. So all of that has been taken away as well to try and action. So the overriding action on that is that every practice should have a named link worker into the community mental health services, and some cases that works really well, in other cases it's clearly not working at all. So we've had quite a focus on that this week as well. So
good, thank you.
Thank you very much.
I take your point about seeing the feedback. We always think it's fairer to let providers see the verbatim comments. If they wanted to share that with you, I would leave that to them. But you will get our summary. You will get a summary and a flavour of what people say.
Yeah. No, that'll be really helpful, Carol. Thanks.
Caroline.
Yeah, it's just a general point really on surveys, I suppose. I think that the question on health, measuring your health status is a good example of it really, because you can ask a question like that and you get an answer and then you don't really know what to do with it. And I suppose the best thing to do is have some kind of benchmarking. Now that might be that you ask the question 2 years' time and you see if it's gone up or gone down, or you might be able to compare it to somewhere else. And I need to look at how the question is asked. But there might be some, if you wanted to send us what you've got, we might be able to have a look and see if there's something we could benchmark it against. Like, for instance, in the Cornwall Residents Survey, we asked some questions on people's health. But of course, if you ask it in a different way, you can't then...
Yeah. We asked exactly the same question 2 years ago, so I've got all that data still. So it becomes an ongoing narrative then to see what people are saying. I do think it's noticeable though that people use that section to talk about something else entirely that they were grumpy about. So it was a bit skewed this year, but certainly we can give you comparative data.
Yeah.
So I'll send you that anyway to have a look at.
Yeah. Okay.
Make
Fine.
a
Thanks.
note.
Any final comments to Carol?
Just on benchmarking, it's really topical that today the mental health benchmark has been released. It's in the CCG staff bulletin, so no doubt we'll be reviewing that as well to compare local performance against national.
Okay, thank you.
And I'm just really looking forward to hearing how the takeover day goes. Is it next week with the
next
children,
Friday.
young people going to our local health watch?
Brilliant.
Okay, thank you very much. I think that takes us now on to item 8, which is the last report in part 1 of this afternoon's meeting. Are you able to go for it, Bob, to kick off?
I'll kick it off.
Okay.
Thank you, Chair. Hope we've all had a chance to read the paper. This came as a way of, as a Chair's suggestion, to develop a work plan with a small number of key priorities, and appreciate that the board has a number of other responsibilities with oversight of Better Care Fund and input into plans and strategies. But this was perhaps a way of being able to focus on the kind of partners' attention on areas of overlap with individual organisational priorities and resource. So there's no budget attached necessarily to the Health and Wellbeing Board, but there is clearly a collective will to make a difference locally. And I'm trying to think that this opportunity here to develop a healthy lifestyles programme with a number of key priorities so we can demonstrate to the community how people have worked together and deliver some benefits on the ground. So really I leave it up to the board members to discuss. We've already had a number of comments around the table about collaboration or proactive work around alcohol abuse, those kinds of things. So I just wonder if there is a way of prioritising or identifying those areas where it's feasible for partners to work together to deliver some real benefits locally. So I think I'll leave that open to the board.
Thank you very much. I know in 1.4 you used the term talking shop, and I'm very keen that I know how busy you all are, and I don't want everyone to think they've wasted their time by participating in this sort of meeting. So I'm keen it doesn't just become a talking shop, and that we can evidence impact and outcomes of the work we're doing. So as Bob said, I just want the board as it is today just to have a purpose and focus. So as we go forward, we're able to be able to see where we're making a difference and hopefully making health and well-being a stronger part of the work we're doing. Any other comments, perhaps, at this stage?
I just thought of something, sorry, on the first page of your report, the Marmot priorities, strengthen the role and impact of ill health prevention and health promotion. That's something that people have asked for here more, is kind of more health promotion and more screening like SunSafe and dermatological screening. Now, again, actually, we do have the facilities. They have the facilities at the health centre to do mould checks and send proper photos over to a dermatologist for analysis. But people still want to a sort of a bit of a woof. Once a year, let's have a dermatologist over, and we'll all go up and get our. And that's when you start to pick things up, and that's when people. Yeah. It's a good timely way of getting people to think about sun safety. Yeah. So, ill health prevention, I think, really means proper targeted promotion that gets everybody thinking. It'd be great to have some of that sometime. And again, on drug and alcohol use, sun safety, healthy weight. Targeted little bits of promotion that then the clinicians can pick up and follow up on would be great.
One of the conversations, again, Bob and I have had is trying to almost identify themes for meetings. So Caroline spoke a bit about winter wellbeing earlier today, which is obviously very topical. It's getting chillier, it's getting darker earlier and all those sorts of things. Again, the sort of point you raised would be something perhaps for our May-June meeting to
Well, I think it's for the community to actually say this week we're going to be looking at sun safety. Let's talk about prevalence of skin cancer and protection. So those kind of little proper activities, events throughout the year would be helpful to really. I know there's not a lot in the budget, but it might be something that local clinicians can actually do a lot to support and deliver.
Councillor Grottick, did you have a point?
No, it was more or less the same thing, really, because I was looking at 1.10, and then it fits in quite well with what Carol was saying about, you know, actually, as opposed to just having the facility there, where if you've got a dodgy mole, you can go and have it checked out. The last time they had a clinic, we had a drop-in clinic for a whole day, and they picked up 3 suspicious things that needed sorting. So you could argue that actually it's very cost effective, but of course there's a difference between our council budget, our public health prevention whatever budget, and the NHS budget. And obviously it's something we've got to sort of get together on, isn't it? So
I'm always saying there's a downside to everything. The downside of having a regular clinic, or not whatever you call it, an irregular clinic every 2 years, that somebody may get a mole, think, oh well, they're coming in 3 months' time, I'll wait.
That's true.
That's always the downside, and that's where we come in with the education. You know, we need to get over all the time these messages, don't we?
That's true.
You know, like moles or alcohol or smoking. It has to be a continuous thing, and it has to start at school.
It does, and I take that point absolutely. I don't think we can ever have a regular thing, because budgets aren't like that. It's supported once, and then we have to kind of work quite hard to do it again 10 years later. But I think better information about the facilities that are already here and the help available, which goes and better information about the fact there are facilities at the health centre that have a mole check. There is an adaptation
It's called a GP, Carol.
I know, but better information about what services are available and where they're provided.
But that's education, isn't it?
Again, it's public health
and
education.
accessibility, because people then say, oh well, it's difficult. I have to wait a fortnight to get an appointment. There's a dreadful thing in the Telegraph, a letter from one patient who said that you're only allowed, their doctor only gives them 5 minutes, and you're only allowed to mention one thing. So if you have one problem, if you have 2 problems, you have to make another appointment, which may take them a fortnight. But, you know, that's such bad medicine, because you can have 2 things that you think are not connected, which will ring a bell in the doctor. You know, I'm sorry, it's the failure of our health service.
Can I just make an amusing point on that? Because quite recently, I live on an off-island, and it came to being in the middle of summertime that the people who lived on the island were finding quite a lot of difficulty getting medical appointments. And when we looked around and thought about it all, we realised that actually many of the visitors think it's an ideal time to go and see a doctor, because they can't get to see a doctor probably for weeks where they live. And this is what was happening. And we had to sort of bring it to the attention of the receptionist who just books, you know.
So you're telling me that the doctors on Rough Island have a limited number of appointments, and they come 1 week, and you mean if you can't... Oh.
Yes, exactly. Exactly what happened. And some of the local people were beginning to moan that, unfortunately, the visitors were taking up the appointments. That it was the whole reason why living there and having appointments on that particular day. It was quite amusing, but...
Well, I'm sorry, I don't find that amusing at all.
Yeah, we rectified it. We managed to discuss it, and it won't happen next year.
Thank you.
Yeah.
I'm just reassured. I've just looked at Appendix 1 of Bob's report, and again, I'm just reassured that a lot of what is on there is what's been covered in conversations this afternoon, ranging from access to services, loneliness, suicide prevention. I think if we were to go through and tick, we probably touched on at least 2/3 of those sorts of topics. So again, that just reassures me that our conversations are around the sort of right areas. I don't know if anyone... It's getting a bit shady. Caroline, I think I can see a silhouette of...
Yeah, we're a bit dark, aren't we? Put the light on. Yeah, just a few points.
That's better.
In terms of the paper, I think as you just said, Joel, I think it's in the right ballpark of what the things we should be talking about, and I think it's very sensible. So
So I feel very positive about that. I just wanted to pick up on the issue around mole checks. So we did used to do a lot more around sun safety. We didn't fund it in the sense that we didn't do mole check, we didn't pay for the mole checks. It was still the consultants' time, which presumably was paid for by the CCG, I imagine, or it's not exactly sure how it works out. But we used to do sort of a whole day blitz in a particular area, whether it be a pharmacy or in Newquay or we also do the Royal Court Show. But the honest truth of it is it isn't cost effective. You know, you have a whole day and they might pick up one or two vicious looking moles, some, you know, which may or may not turn out to be something that needs to be removed. The only kind of justification for doing it really is that it's a hook to kind of get people interested in sun safety and their own mould checking. And I think that's the issue really. People just need to have their own skin awareness and actually be able to spot whether a mould's changing or not. And the actual time criticalness of it is probably not as acute as you'd imagine. It's more, you know, the fact that someone waits 2 weeks or even 3 months probably doesn't really matter. It's the one they ignore for a year or so that is where it becomes a problem. So I have kind of mixed feelings about that. And I think it would have to be up to the dermatologists to say whether they were willing to do it. Or indeed, it could be something that the GPs may or may not be willing to do through teledermatology. You don't necessarily have to have a dermatologist present at the time, do you? Through that.
On the back of the last clinic that was supported by the council, and a dermatologist did come over.
Yeah.
The League of Friends bought a dermatoscope.
Yeah.
So they can take these measured technical images and send them off to a dermatologist, and I think they. I don't know, but I think I can remember them saying that people coming in for checks increased after that and has probably dropped off again. So again, it's just awareness, just reminding us, the community, of what services do exist. A lot of people told me in the community survey that there is no access to on-island eye tests. And there is, and there has been for 2 years. So it's just getting that information up and out there, I think, is quite important. And that's a shared responsibility.
Yeah, and the other thing is, the other problem, of course, is that it's often the same people that come back to have their moles checked, and it's the people who you don't reach, still don't reach. They're still not coming forward, and that's a challenge.
That health promotion message and the best way to get it across.
Yeah.
Caroline, you just touched on the budget. Now, I was talking to a colleague on the mainland and I'm just wondering if you can confirm this. We're saying the public health grant is going to not be ring-fenced in due course. And I was wondering if that's correct, and if that is correct, whether that concerns you at all?
We still don't know. It's the simple answer. We're supposed to be moving to business rate retention, but there has been no official decision on that as yet, and it does feel that any official decision on anything doesn't seem to happen anymore from central government because they're too busy doing other things. So as far as we're aware, it's still on for the foreseeable future, the ring fence.
Okay.
But increasing budget, as I'm sure you're aware.
Thank you very much. Any other points to raise on Bob's report? Yeah, please go ahead.
Hi, Sheena from AGK. Just to really comment, it's really interesting to hear the sort of themes that are affecting the community, because we've got our diabetes prevention programme that's due to start on Isles of Scilly, and that's very much about promoting a healthy lifestyle, helping people with behaviour change. So we can certainly, the cohorts that we've began in Cornwall generally, we've been bringing in different people to help people with their lifestyle, so we can really incorporate that into the work that we do on the island. So that'll be a really good opportunity to make sure we're flagging up the themes that are affecting people.
Absolutely. On the island. I think when I was talking to Bob, healthy lifestyles is such it's a very wide, isn't it? An awful lot can be sort of put into that. So it was. I didn't want to make it too narrow. I didn't want it be too specific. So it deliberately went for that sort of broader headline that allows 101 things to be factored into it.
Yeah.
Something might just be worth mentioning is that within the STP there are these almost the same priorities that are in this paper. So it's around the healthy lifestyles. There's a bit about wider determinants, and then the other area is about sort of self-care, self-management of people, particularly people with long-term conditions. So those are the same themes that are coming out. So there will be work being done in all of those areas.
Absolutely. Bob, did you wish to?
Yes, I just wondered. Caroline just mentioned the SDP and also yourself about the very wide range of priorities we have. It's just wondering about the key themes. If you could narrow anything down today, I think what Carol said about shared responsibilities ties in with a lot of what you discussed, and perhaps ties in with the offer of training when public health come in the new year. Is that linked with that? I mean, that's one thing. That then the diabetes prevention and other things all kind of fall under.
And the alcohol work that Angela touched on as well, obviously, is...
Yeah. So you've got a programme, a beginnings of a programme in place, delivered by partners.
Yeah. So would that be one of the key things the board would like to see under this healthy lifestyles option? So. That would be great. I mean, there's other aspects that can be developed, I'm sure, and it would be nice to have one around children, perhaps, and maybe social inclusion, those kind of things.
Wait and see what they ask for next week when they come and talk to us. They'll come up with some ideas.
Good.
I will bring them back to you. You will include them.
Well, it's sounding as if from your table and our table here, we're happy to move forward in that sort of general direction, and accept the recommendations on page 119. I think that concludes again the formal part of the meeting, but we've got 2 or 3 minutes. If anyone's got anything pressing which hasn't been touched upon in any other part of the agenda, if you'd like to throw it into the floor now, feel free to. Councillor Grottick.
Thanks. Can I just say, I see I've noted that we were going to have the Section 75 agreement with presumably special reference to the Better Care Fund, but we certainly are not in receipt of it. I've seen that come along, but I think there are areas, if I'm familiar with with an area that I looked at before, I think it should possibly be in part 1, but I'll leave that obviously to you to discuss with the officer and anyone else who might have thoughts on it.
I think Bob might be able to elaborate on that slightly.
Yes, I think, I'll probably hand over to Jill to give a brief description. And is it fair to say that the Section 75 agreement basically enables the commissioning group to pass funds on to the authority on completion of the programme?
It does. It allows us. It's a legal agreement that allows us to pass on the funds from the Better Care Fund, but also pool funds from other sources for other schemes if we wish to do so. So I must apologise for the fact that you've not got the Section 75. We've had quite a process this year in which we've had to go to a new version, and we have recently completed last year's, but also commenced this year's. But both have separately got to go through a legal process. Actually, the deadline for signature is 30th of November. So, as I said to Bob, what I'm doing is actually cutting my teeth on the Cornwall one. Because what we've done, we've changed the approach. We've gone to a thematic approach, which will allow us to be very agile with the Section 75 and put in and take out schemes as we require and agree through the normal governance processes, but will allow us that agility where we feel that a scheme's not working or we have a different priority, that we'll be able to quickly or more quickly respond to that. So the Section 75 is part of the admin, really. So what I'm going to do, or I have done, is it's currently with Cornwall Council legal team for scrutiny. We are in the process of fine-tuning the final elements of it, and then hopefully we are on schedule to get that signed by the 30th, and hopefully the Isles of Scilly version will be sent out next week. But I mean that can be circulated by email if anybody would like to look at that dynamically, and I'll be contacting Aisling to progress the themes. The themes, I haven't discussed with Aisling yet the themes, but the themes broadly for Cornwall, and we wouldn't see them massively different from for the Isles of Scilly unless unless that's indicated, are prevention, integrated community care and strategic commissioning. And that will incorporate the Better Care Fund and the Improved Better Care Fund, as well as the Disabled Facilities Grant.
Councillor Grottick.
So can I ask what democratic member input there will be then to what is obviously quite a significant document? I mean, to which committee or forum will it come?
All right, it will come to this forum. The members of the Health and Wellbeing will see it, but really all it will do is it will encompass the schemes that you've already signed off.
Yeah.
So the schemes that were visible to you at the last meeting, but signed off prior to my involvement with that, you've already seen them. So it will be nothing new. This is just like the legal envelope that allows us to transact the monies basically. But comes with that is obviously the governance that's wrapped around that, is the fact that we have commissioning discussions, we have the schemes, we monitor them, we report up nationally to the DCLG, Department of Health, jointly and individually, and this group has the overarching body for that pot of money, if you like.
Yeah. But since this was coming to this board today as a Part 2 report and it hasn't, will it be sent to us when it's ready?
Yes, it will be, and we've discussed with Bob that it can be circulated by email. There's no penalties for not signing it if you'd rather wait until the January, but it's better practice that we can transact financially that it's signed.
And presumably the chair and the vice chair of the board will have the facility to look at it prior to its signing?
Definitely. Well, they have to sign it. The leader of the council has to sign it and it has to be approved. So it won't be signed without sight of this forum.
Okay. So you're proposing... And
Ashley and Bob will probably coordinate that from within your organisation.
Fine, as long as there's that facility, then I'm content. Thank you.
Yes.
Okay, thank you very much for that explanation. Any other queries, any comments at this point? In that case, I think we'll conclude the meeting and everyone can move on with their lives. Thank you very much indeed. Bye.
Thank you. Bye. Bye.
You are the only participant in the conference. The host has left the conference. The conference is about to end.